Uh, Hello, hi there. I'm Aditya. I had worked as a public health nurse between March 2014 to May 2018 in a very less privileged district in Maharashtra. I was there working in the civil surgeon's office, that is district hospital, and my work involved to be act as a liaison between the state and the periphery. I was reporting to the civil surgeon and the residential medical officer outreach, and I was responsible to monitor, evaluate, and report conduct and carry out reporting of every national health program pertaining to maternal and child health, and I did that for 4 long years. And during this time I had a very good opportunity to connect with the female healthcare workers, especially the frontline workers who worked in rural hospitals, sub-district hospitals, district hospitals, women hospitals, PHCs of the district that I worked in. And I was constantly in touch with them because my work involved getting targets done, getting the details about the implementation of national health programs in their areas, in their institutions, in their community, as well as I was involved in reporting these things to the state. So it was inevitable for me to get in touch with them. Like, yeah, every day I used to make at least 10-20 phone calls every day, send emails, and conduct meetings, conduct trainings, and everything for the female healthcare workers. So I am very much aware of all the challenges and all the issues that they face on the ground, especially the A&Ms, to be very specific about. And I don't know how much time do I have, but I do have a few points to share for this webinar, especially which focuses on a 40th year of Alma Ata, and which recognizes the contribution of women healthcare workers, and also recognize the challenges they face in current socio-political context in India's healthcare system. I would focus on challenges the women healthcare workers face, especially the frontline workers, as well as the issues of women nursing workforce. I have few points that I've written down for challenges, and my first point is very basic and very crucial and essential. That is low wages. The district that I worked in, the A&Ms got somewhere between 7 to 10,000, yeah, 7 to 10,000 per month as their salaries. The disparity between 7 and 10,000 was because the nurses, the A&Ms who work from about a longer time had a less salary compared to the A&Ms who joined recently, that is in 1 or 2 years, because they came under a different pay scale. I don't know how this was possible, but this was the reality there. Yeah, so that the older ones got 7 or 8,000 and the new ones got 10,000. But later on, I guess this disparity was addressed. I don't know about that, but yes, 10,000 to survive in rural area is really less. You might think that the people connected to this webinar might think that 10,000 is quite fine for people living in rural areas, but we have to take in context their socioeconomic status. These women who are A&Ms do come from a very not do come from a family which do not I don't think they do well, because I had a good relationship with them. As a public health nurse, I used to talk to them, and I used to like have good conversation with them, and many out of them did not come from a very rich family or very well to do family or even a middle class family. So 10,000 was all they got for their family, and 10,000 to survive in this age where the prices are skyrocketing for every other thing is not enough. Second and very important point, that challenge that I feel, that I observed when I worked with these women, was the disparity between the competency level and the accountability that they were expected of. What I mean to say is, a person cannot be low competent or less competent. A person can either be competent or incompetent, and a person can either be accountable or not accountable. There is no space between these, and this is a major issue with female healthcare workers, especially the frontline workers, because there is an ever increasing number of national health programs and other healthcare programs that are bombarded on them. For examples, I can say that in recent years, the Pradhan Mantri Surakshit Matrutva Abhiyan, that is PMSMA, was introduced. The mission Indradhanush was introduced. There was maternal and child health tracking system, that was MCTS, which now has been revisited, revised, and an extensive RCH portal has been created. These are only the three important programs that I'm listing down. However, conjoining with this, there are various national health programs, like you can say, the routine immunization programs, the ANC care, ANC clinics that go on, and everything, that the polio campaign that goes on twice in